Good morning, nurses. This is Aran Sakshi. So, in today's video, I'm gonna give you an important update. Actually, I have also learned this from my workplace, and it's happening, more frequently, especially with new grads, either they're RN or LPNs. Because I completely understand that thing. Like when you are like new to the floor and an international nurse, right? So it's a very quick tip. So what you have to consider is like what happened in my workplace was one of my coworker had like incident, like not we can say intentionally, but she was pretty much confused about it. So as she was very new, so one of the residents' wife asked for Tylenol because the patient was having a pounding headache. So, what the nurse did, she gave that Tylenol to his wife without an standing order. So, guys, this is a medication error. Without a standing order, we cannot prescribe, we cannot give any medication. Either it is related to pain, or we can say a bowel protocol, diarrhea, or we can say even if we have to check the blood pressure or the weight, right? Say like if the patient is on Lasix, right? And the doctor says, okay, I'm phoning regarding this patient John Smith, and I just want that you have to check his weight regularly on frequent basis every day. So what we will say to the doctor, we will say, okay, doc, I understand that. Can you provide me the standing orders? I am doing the fax or whatever email according to your organization's policies and procedure. So that's the best answer for that one. First, always check your policies and procedure, or you can ask your wellness director or your DLC, right? So it's your utmost responsibility to check that does the patient have standing orders, right? Even though there was no harm to give the Tylenol, but we don't know like what's going to happen next. We have given that acetaminophen or Tylenol to the patient. If any side effects happen to that resident, who's gonna get involved in that incident? Nurse, right? So guys, it's our license, right? You have to protect your license. And the other thing is, some nurses might think, okay, what's standing orders? So standing orders are the written set of instructions on a piece of paper. It's depending upon your policy, like policies and procedure of your organization. Like there are some, you can say, items enlisted on that piece of paper, like bowel protocol, diarrhea, acetaminophen for pain, right? Blood pressure checking or urine analysis, right? So these are some items listed on that standing protocol, so that the nurse, like RN, LPN, or any paramedic, can prescribe, supply that particular medication or test to reveal any critical condition ongoing with the patient.